Hello, so today we have a patient who is 27 years old who lost about 150 pounds and does not like the shape of their arms. So today what we're going to be doing is what's called a crescent arm lift. So I'm going to do an incision in the armpit and excise skin and fat up in the armpit and take out a crescent area of skin. I'm also going to extend that incision partially down the arm, not all the way to the elbow as I usually do, but about midway down the elbow to get rid of that excess skin, sort of in a wedge shape. So let's go to the operating room and I'll show you how we do it. So what I'm going to do is I'm going to make an incision here in the armpit, like that, extend it around to the back of the arm, same thing on this side, extend it down, and then I'm going to dissect down here to about the mid portion of the upper half or upper third of the upper arm, and I'm going to resect this wedge or this triangular area of skin and a little bit of fat in the upper arm, and then close that. So you can see the silhouette once I remove that. This patient is going to have a nice silhouette from the elbow straight into the armpit. What basically is not appealing in this case is that excess skin and fat that's hanging there. So from the back side, you can see I'm going to extend that front incision about up like that and about up like that, and then continue that triangular resection out to about there, and you can see what I see is that silhouette of the arm underneath there that's hiding under this excess skin after 150 pound weight loss. So let's go to the operating room and I'll show you how we do this type of arm reduction. So what we're going to do here today is a modified crescent arm reduction. So I'm going to make an incision that comes here up into the armpit here, a contralateral incision back here, back, and then I'm going to dissect down here and I'm going to resect this area of skin and fat in the upper anterior arm and get this patient a nice chiseled 90-degree arm right in there, like that. So I don't go all the way down to the armpit on this, from the armpit to the elbow, because look, out here, not much excess skin and fat. This is just pretty good skin turgor, pretty good skin fat down in there, so I don't think we need to do that. So we're done with the arm reduction here. And what I did is a partial crescent incision and a modified incision down the upper 1/3 half of the arm, as well as a little Z-Plasty in here to minimize the axillary contracture or scar tissue. So this patient's going to get an excellent result, nice skinny arms, a lot of its excess skin and fat is gone, and this patient did not require the incision from the armpit down to the elbow. So that's how I do a modified arm reduction through a crescent Z-Plasty incision. So that's how I do a crescent with a modified extension arm reduction on a patient that lost about 150 pounds. So the key thing about this surgery is it doesn't go all the way down to the elbow, and it limits or minimizes the scar length of the upper arm after about 150 pound weight loss. So thanks for watching. Please subscribe.